Hello, I'm Dr. Elizabeth Coyne and I'm presenting today just a bit of information about this course 7202 NRS, Preparing for Advanced Practice. Now in this course we're going to look at what it means to be an advanced practice registered nurse and what type of roles and what they actually can do in the clinical area. So first, a little bit about me. So I completed my registered nursing in Townsville General Hospital. I was hospital-based. I've worked across most hospital areas and in a range of different hospitals. I completed my master's and then my PhD, and now I'm a researcher and have been working as an academic for many years. And really what my whole aim of my research and my teaching is to look at sort of how we can actually improve the outcomes for the patient and family when they're looking and facing chronic disease or health adversity. So the first thing I want you to do as you start looking at this course is really post a bit about yourself in the Teams site. This helps us to sort of understand and really grow from each other's nursing experience. So really sort of make sure you get onto the Teams site, post a bit about yourself, where you work, what your aims for you doing your Masters is about. With the actual course that you're completing this trimester, we're going to look at the course learning outcomes, and this is really looking at the development of the advanced practice in nursing. So what it means in your own healthcare setting and what it's meant over time. We're also going to look at and critique the characteristics of an advanced practice nurse and how they really look at supporting that advanced practice in the clinical setting. We're going to look at the aspects that influence it, legal, social and ethical factors, and you'll notice this in your assessment items. So really be aware of what are those factors and how do they influence the advanced practice nurses in your area. We're also going to look at how you actually then articulate this role of the advanced practice nurse and how you might actually change practice, how to innovate and influence a practice change, and that's assignment number 3. So just to look at the assessment plan, we've paced them over the trimester to really build your understanding. So the first one is just to look at the role of the advanced practice nurse in your area. And then it's to really look at what is happening in your area and what needs to change in practice. So this is your environmental audit. And then in the last assignment is you actually develop a change management plan. So this is including timelines, being informed by a framework, and to really look at sort of how you as an advanced practitioner could improve practice in your clinical area. Make sure as you're looking at these criteria to really understand what they're asking. So look at your area, research the topic, go over what's expected in each assessment item. Develop a plan or an outline, and make sure you actually look at the word count, because now the word count is a word count and it's not an over percentage. Make sure you understand how to reference APA 7 and follow the guidelines for submission. So there's 3 modules and they're nicely updated with current research, where they are really aligned with the assessments. So what I've done throughout this course is make sure that the actual research that you've written, the references, are pertinent and really relevant to you understanding the assessment items. So make sure you have a look at what I've put in as the course references. They're also in all the readings, and so if you link into the readings, you'll have a whole range of current research to actually start thinking about your assessments. Really develop this sense of sharing with the activities so that you're on the Padlets, you're using Teams. Make sure you use the library resources, because these are sort of resources, the library databases that you can really use to help understand and present good references for your assessment items. And just in summary, make sure you look at the course content. Make sure you look at the course profile, understand the rules for students, have a look at the assessment items, when they're due, exactly the expectations. As you work through the modules, make sure you're thinking about what you need for the assessment items. So when we're talking about it, clinical audit, have a look at the audit assessments and the current research that I've put into the modules. stay in contact with me over the trimester. Really make sure that you, use the team site. Email me if there's questions. And really make sure you engage with your other students. And I'd just like to thank you for enrolling in 7202 and hope you enjoy that trimester. Thank you.